According to the CDC, in studies published in 2016, over 44,000 Americans committed suicide in 2015. The CDC also states that suicide is the 10th leading cause of death. If you or anyone you know have been impacted by suicide, you know just how valuable it is to get help. Yet this is not going to be possible without the support from others. I have spent a significant amount of time researching suicide. Unfortunately, my sister had attempted suicide several times. Luckily, I still do have her here with me today, thanks to the help she received from her counselors, psychologists, and most importantly, suicide support groups. Today I'm here to inform you about the crucial funding suicide support groups require in order to impact the community. There are three main types of ways that suicide support groups receive funding that I will be addressing today. First, the federal grants that these mental health groups receive. Second, the private grants that groups can apply for and help to aid their program. And finally, many groups will also receive private donations from members of the community to aid them for success. In order for a support group to provide services to the community, they must receive funding from an outside source. Many organizations will receive federal grants to support their mental health services. According to the grant information published by the U.S. Department of Health and Human Services in 2016, several grants are available to aid community health organizations. Some of the specific grants available include Community Mental Services Block Grant, available for the community mental health treatment for both adults and children, Community Health Center Program, which is available for any underserved community, and Community Services Block Grant, available to luckily all 50 states. According to the National Council for Behavioral Health in 2016, over $60 million of the available funds from the Community Mental Health Services Block Grant actually were specifically allocated for suicide prevention in 2015. Now, federal grants are helpful, however, funds are limited as they provide grants to all 50 states. Additionally, community mental health programs also receive privately funded grants. Private grants from foundations are essential in the success of providing mental health and suicide prevention to the community. As we all know, grants are free money provided to address specific need. Often, these come from major foundations associated to your cause. As stated by the USA Government Grant Organization, foundations provide grants if you can demonstrate a clear need for the funds. HealthWest, a mental health organization in Muskegon County, reported in their 2017 annual report that nearly $3 million of all their funds available in 2016 came specifically from grants. It would be impossible to name all the foundations that provide grants available for suicide prevention. A few of them include the American Foundation for Suicide Prevention, the Substance Abuse and Mental Health Services Administration, and the David Nee Foundation. Without the federal and private grants available, suicide prevention support groups would be unsuccessful in their prevention efforts. On top of grants, donations from family members and members of the community aid in the success of these groups. Private donations additionally are available to help support groups reach out to their community. The National Alliance on Mental Illness states on their website, NAMI.org, that private donations allow them to improve the lives of millions who are directly affected by mental illness. Many counties in America, such as Washtenaw County in Michigan, have their own branch of the NAMI. The NAMI reports in their 2016 annual report that 77% of their finances available came from donated contributions. This is a huge number. Without the help of their donors, they would not exist. The same applies to many organizations. So today we've discussed the three ways that suicide support groups are able to receive funds. First, we have federal grants, then we have private foundation grants, as well as private donors. Without financial assistance, suicide support groups would be unable to aid the community in the prevention of suicide, and unfortunately we may end up seeing signs such as this if these support groups are not funded. If you or anyone you know may be in danger to themselves or others, please reach out. Please call the National Suicide Prevention Lifeline at 273-8255 if you are having suicidal thoughts. Share this number with anyone around you to save a life. A suicide support group's goal is to help. Let them help.